Reverend John Azuma has lived with HIV for 24 years. He is one out of millions of people in Ghana who benefit from free antiretroviral drugs to stay healthy. The United States Agency for International Development, USAID, plays a key role in the distribution of the drugs to HIV patients through the U.S. President's Emergency Plan for AIDS Relief, PEPFAR.
That program has been a great program, wonderful program, because if it hasn't been that medicine, we would not be alive today. Many people have died because they didn't have access to medication.
Reverend Azuma set up the Motherly Love Orphanage in Accra about 17 years ago to cater for abandoned children living with HIV. He is worried that President Trump's freeze on USAID operations in Ghana could seriously affect his life and that of the children here.
Our life is all around the medicine. So for us to hear that the agency that provide the medicine is no more going to provide because they are cutting the funding, it was a big blow for us. And everybody was very sad. The children were asking me a lot of questions that I couldn't even provide answers.
The suspension of USAID operations is likely to disrupt many other public health services, including malaria prevention, support for maternal and child health, and other infectious disease prevention. Managers of this shelter for children with HIV fear they may run out of the antiretroviral drugs currently in stock before the 90 days USAID operation freeze expires. And when that happens, they may not be able to afford to continue buying the drugs themselves. Ghana is estimating a funding gap of $156 million due to the suspension of USAID's international funding program. It is projected that a shortfall of about $78 million will seriously affect critical intervention in the health sector, including malaria, child health, and the fight against HIV and AIDS. Local organizations that have been collaborating with USAID on HIV and AIDS awareness campaigns also fear they may close shop.
If we stop, there's going to be a general catastrophe because all the gains we've made will start reversing. And we're going to see the prevalence go up.
Campaigners say Africa must now begin to look within to fund its health sector, and governments on the continent can consider implementing the African Union Pact known as the Abuja Declaration, signed 20 years ago, to commit at least 15% of its annual budget to health care.
We have no option than to go back to the Abuja Declaration and commit more resources to the health sector.
President John Mahama has asked the finance minister to urgently come up with a plan to bridge the funding gap. Back at the Motherly Love Orphanage, Reverend John Azuma and these children living with HIV are uncertain of what the future holds for them, but they are keeping faith with God to make a way as they sing songs of praise. Nabil Ahmed Rufai, CGTN, Accra, Ghana.